Thank you all for coming. I'm Barbara Dockin, the president of the North Highline Unincorporated Area Council. Our council meetings are here every Thursday, first Thursday of the month. So our next meeting is May, I think it's 5th. Well, whatever the first Thursday is.
I think
The first. Oh, May 1st. Okay.
Oh, wow.
7 o'clock right here. And if you're new, if this is your first meeting and you want information, we have a list here. You can put your email address. I send out a blast email before our meetings. So we're really thrilled tonight to have our District 8 King County Council representative, Joe McDermott, here. And we're very pleased to have Matias Valenzuela, who's the coordinator of the Equity and Social Justice Initiative, and Adrian Quinn, who's the director of Community and Human Services. And I'll let you guys. Thank you.
Thank you. Well, we were asked to come join you this evening to present on King County's Race and Social Justice Initiative. And to just kind of frame that, I'll kick it off and say that we're not here to tell you anything new in some respects. White Center is a unique community. And that's not just because you're the home of the original Taco Time, or Uncle Mike's Barbecue, or Zippy Burgers, or Proletariat Pizza, the Salvadoran Bakery, Full Tilt Ice Cream, and I've missed a whole lot of other reasons. But another reason why you are unique is because you're in an urban, unincorporated pocket of King County. King County is your local government. Yet you live in an urban environment. And King County, so therefore we're here tonight as representatives of your local government to talk about some of the work we've been doing. And in particular, I've had the pleasure to represent North Highline in one format or another I'm in my 14th year, which surprises me. Adrian's probably more surprised than I am.
You don't look a day over 12.
Sweeney, you knew me when I was 12. You know that's
I knew you folks before you were born.
And in the State House and later in the State Senate for just over 3 years on the King County Council. And we're here really to talk about the county's formal and daily commitment to equity and social justice. It really began as part of the strategic plan that King County adopted in 2010, when we adopted the fair and just principle as part of that strategic plan. And the principle really means that we work to integrate equity considerations into everything the county does. Do we do that perfectly? No. Did we have a lot of ground to cover when we started? Yes. Do we have all the money to do it when we identify issues? No. But should it be part of our ongoing commitment to all of the communities that we serve? Yes, and in fact it is. The initiative has given way to King County's annual report on equity and social justice. And this report confirms that where you live, how much you earn, and the color of your skin are major predictors of your chances of living well and thriving. This work is incredibly important because our region is growing and becoming more diverse. In 1990, 17% of the county's population was made up of people of color. In 2010, it was 35%. And that's true in North Highline as well. In 1990, 76% of North Highline residents were non-Hispanic white, were white. In 2010, 40.3% were people of color. In 1990, 76% of North Highline was white. And in 2010, 40.3% were white. One of the best outcomes of this initiative is that the county is talking about equity and social justice. It's no longer an unspoken assumption or belief or hope that all residents have equal access to opportunity. And for me, serving as a policymaker, That means as policy is working its way through the county, and particularly through the council, we look and discuss if the proposal before us would have a disproportionate impact on already disenfranchised groups. We look to see if it promotes opportunity for all. One of the most recent examples of this is the work we've done around Metro Transit and setting up a $1.50 low-income fare for Metro riders. We would be the third jurisdiction in the country to have a low-income fare. That would be $1.50 as we anticipate at this point in time. The fare will help ensure that everyone in our region can get to and from work, to medical appointments, to the doctor, to school, to job interviews, to whatever work and play and social events we have. It also helps to offset the fare increases riders have had to shoulder as the county has exhausted its authority to fund Metro Transit at its current fiscal levels. As part of the social justice initiative, we look to address determinants of equality. Traditionally, local governments have focused on many of its services on treating downstream conditions, the things we see every day: homelessness, incarceration, disease. We see people incarcerated. We know there's a high recidivism rate. So we work with people coming out of our jails and prisons to find gainful employment, to have this education and skills to be successful. We see somebody who's homeless. We find them shelter, temporary shelter, then maybe long-term shelter. But to really help address equity, we need to not focus on the downstream, but focus on the upstream. Now, in the short term, that can actually be more expensive because we're not going to stop helping people who are homeless or are incarcerated and about to be released now. But we're trying to get about several steps ahead of that so that people don't end up homeless or aren't incarcerated in the first place. In some of those roles is where my role as chair of the Seattle King County Board of Health really becomes important. In King County, 48% of deaths are preventable, meaning that 48% of deaths are premature here in King County. 38% of those premature deaths are attributed to tobacco use, 34% to poor diet and lack of physical activity. And so the board has developed innovative ways to address these premature deaths by working to address some of the root causes. King County was the second in the nation to require menu labeling. So now patrons in restaurants can have a better idea about the health effects, the nutritional value of meals they're ordering. The board was also an early adopter of regulations limiting the sale of e-cigarettes, helping to control teen and youth access to nicotine. And we've been a loud advocate for maintaining a strong Clean Indoor Air Act, the legislation to prohibit smoking in all indoor public spaces, to make sure that all employees benefit from clean indoor air. But our work certainly continues. Efforts to drive down tobacco use and physical activity have been highly effective in our affluent communities. And in fact, King County has some of the highest health outcomes in the country as a whole. But when you break it down, we also have some of the greatest disparities within the county. Health outcomes in King County for those who are educated and wealthy are disproportionately higher than outcomes for those who are less educated. And when we look at where that is, it's not the individuals, but rather the individuals are influenced by place, by where they live. Communities with shorter life expectancies often have limited access to fresh, healthy foods. They also lack important infrastructure like bike lanes and sidewalks to facilitate physical activity and even just walking through your neighborhoods. And that's why the Board of Health looks at community and prevention-based solutions for public health risks. One of our policy tools that we've armed ourselves with, actually created during my tenure, is policies and guidelines. Not a requirement, not setting down regulation, but suggestions And these allow the knowledge of public health experts to make knowledge available to other policymakers, countywide or in cities and smaller jurisdictions. We've done that in some successful ways already by planning for healthy communities, which are land use suggestions and guidelines for jurisdictions to use regarding everything from sidewalks and connectivity to neighborhoods, and healthy vending guidelines, suggestions, again, not requirements, from the Board of Health about what kind of foods might be healthier choices to have in vending machines around the county. And so in my role as your King County Council member, it's my job, my obligation to challenge myself, to challenge the county as a whole, and to challenge you to step up and do all we can to address social justice and equity. And I'm really pleased to be joined tonight by Matthias and Adrian. Matthias is housed within public health, but is actually the staff person in charge of overseeing all of the county's efforts in equity and social justice. And Adrian is, as she was introduced, the director of, help me, Community and Human Services Department. And it was quite a coup for the county to steal late last year. So I'm very happy that Adrian and Matisse are with us tonight to really talk about some of the work the county is doing. And I know you have visual aids.
I sit within public health, so we have slides. So if it's okay, I'm going to stand up. And actually, the Councilmember McDermott, it was great, some of the comments that you were saying, and I'm going to go further into it, and I know we had a request of providing a little bit more in terms of the data and the numbers and seeing what we're seeing here in King County. But first of all, thank you for inviting us to join you tonight. So I'm going to ask you.
Let the lights out?
Yeah, if you can lower the lights, that'd be great. So next slide, please. There we go. So this is a map of the United States, of course, and by one of the really important indicators that we have of health and of quality of life, which is life expectancy. And the darkest green areas are the areas where there's the longest life expectancy. And when you then moving into lighter green, yellow, orange, and then eventually red, where you have red and orange, that's in the places of the county, places in the country, and this is by county, where you have the lowest life expectancy. If you look at the state of Washington, it's quite green. If you look at the southeast, that's where we have some of the areas with a lower life expectancy. But actually, if you look at King County, it's the darkest green. So when you look at us as a county as a whole, we're doing quite well. And if you also hear and you read Seattle Metropolitan Magazine and those kinds of places, and you see rankings of where we look, nationally, we often come up as one of the places that has really high standard of living. People are living really well. We have strong businesses. We have Boeing. We have Starbucks. We have Amazon, Costco. All the strong industries. So that's generally the frame and the way that we like to talk about ourselves here in King County. But the story is a little bit more complex than that, and that's what we're trying to address with equity and social justice. Next slide. So this looks at that same indicator that we're looking at before, which is life expectancy, but then breaks it down by census tract. And you can begin to see some of the big differences that we have by place, really by where you live. And the areas that are in blue is where you have more than 92 years or over in terms of how long you will live. And then moving into the green, which is between 83 and 92. The yellow is 80 to 83. Orange is 77 to 80, and then red is 68 to 77. You can see the area that we're in is on the lower side of that. But the important thing is to see here that within our county, where you live, and this is independent of everything else, all other indicators, where you live is a huge predictor of how long you live, and essentially your quality of life, and what access to resources you have, and what opportunities you have. So it's really talking about more than a 15-year difference just based on where you live. Pretty significant. Next slide. So also, the story is that it's, when we look at this in King County, it's actually place, but also combined with a couple of other really important indicators or factors, and one is people of color, and then low-income communities. Really, those are very much closely connected. The relationship between place, race, income, and then outcomes, with the outcome that we see. And you begin to see a pattern, and we can begin to see, here we have one particular outcome, which is educational attainment. And you begin to see that in the area around South Seattle and South King County, the area that we're at, there's some pretty significant, and this is the red areas and the orange areas, where you have outcomes that are not as good as the rest of the county. And this is a pattern. We could be putting, Council Member McDermott was talking about some of the things that they do in the Board of Health, and we could talk about healthy foods and a number of different things around obesity, tobacco. It's going to be a very similar map that we see in terms of outcomes. It gets repeated over and over and over again. So this is really what we're very concerned with in the county that we're trying to address. Next slide, please. Also the issue of demographic changes, and we all know and we hear, for example, nationally, that by 2042, we're going to be majority-minority population. Already, you can see that if you look at the young population, that it's very diverse. So if we look at King County, we're actually heading in a similar direction, of course, and I know everybody here living in White Center are very familiar with this particular issue. You look at King County between 1980 and 2010, you can see, for example, some of the changes that have happened in terms of becoming an increasingly diverse population. So those are from 1980 and 2010. That really looks at the population as a whole. This particular one on the way on the right looks at those who are the children, population under age 18. And already in that age group, in the 2010 census, we are already almost at 50% people of color. So that's really an indication of where we're going to be in the future and where we're heading. Next slide, please. So this is, wanted to provide, I was asked to go further into some of the data and some of the information here for the North Highline area. So this is what we can see. If King County is seeing this shift or this change, it's actually even more pronounced for the North Highline area. And we can see that don't have actually in this one, it's for some of the main groups. There's also, that's why for 2010 the numbers are not up to 100 because you can be more than one race, a number of different things. So it's just some of the main categories that I have the data for. But you can see that in 1980 it was 88, almost 90% white. At this point it's about 40% within this particular area. And you can see other groups, how they've grown drastically as a percentage of the overall population. While the population here has remained, it's grown by around 6,000 people, but it hasn't been a huge change. It's been more of a shift that's happened in the demographics here. Next slide, please. So there's a lot of information here, and I'm going to make sure that we get copies here too for this information and data that you can have if you want to look at it more closely. But this goes, the top part looks at median household income and really comparing the North Highline area with the rest of King County. So what you can see that in 1970, the median household income in North Highline was $9,000. In King County it's $10,200. If you go through the years, you start seeing by 2010 that gap in King County, between King County and North Highline, there's a pretty significant gap and difference. If we also see in terms of people that live below poverty, it's a similar type of situation in terms of King County. The poverty rates in North Highline versus King County has been increasing across time. And so this is really the essence of the work that we're doing, that we have seen that though some people, some populations in King County are doing extremely well. In fact, we have some of the healthiest people in the world. If you look at those places where people live more than 92 years, in terms of their wealth as well, they're doing extremely well. But that's not the shared story for everybody here. And what we have is a growing gap and the fact that even actually some populations are even falling further behind. So that's something that we feel if we want to have a shared prosperity for our region, we really need to be addressing this. And that's why King County government as a whole has been taking this as a priority. Did you have
Yeah,
a
so I was
question?
thinking, did you take into consideration when you did all that, the numbers, the high density, more and more that people are bringing low income to this area, more and more low income, and how is the government going to take that into account to improve the situation?
And that's a great question. What we're going to do is, what we want to do is, we're going to get through the information, and then we're going to have an open discussion about these things. So, great question. So and Adrienne too says that she'll address it probably in her remarks. So this is really what we're looking at, what we're trying to address. Next slide. So, and then Councilmember McDermott was talking about this particular the stream and working upstream and downstream. This is actually a visual of this, and this is what we often talk about when you work upstream and really working around prevention and working downstream. The left side of the slide is upstream, the right side is downstream. And when you look at this, is really where government generally has tended to work, and it's not just government, it's also a lot of many of the community-based organizations, nonprofits, social service agencies. We tend to do our work on the right side of the stream. You know, King County spends a huge amount of our resources around the criminal justice system, the incarceration system, right? I mean, we run the courts and the jails, and we have other efforts around that. It takes a very large percentage of what we do. A lot of things addressing the effects of obesity, health problems, homelessness, untreated mental illness, low birth rate. We can continue to focus our attention downstream, really, which is about stopping the bleeding. We have issues that are, pretty serious and focused there. Or we can say, let's think about, and also with diminishing funds and having to be more efficient, what can we do? And we're saying, well, let's move upstream and let's try to focus in the middle of the stream and then to the left of the stream as well, which means looking at the conditions that we want everybody to have access to so they can really achieve their full potential, and then they won't need to have as many of these services. We're probably always going to be service providers, but really how can we decrease the burden that we have and the huge impacts that are happening down here? So how can we have such things as affordable housing, good paying jobs, quality education, access to transportation, access to health care, healthy environments, access to healthy foods and physical activity? How can we create the conditions for everybody to have access to these conditions? Next slide. So really what we've done is integrated. It's not we don't have equity and social justice is not a separate program that we have within the county. We have passed a strategic plan back in now about 4 years ago. And as part of that plan, one of the principles that was put in there by our elected leaders, it was a very smart move to put actually fair and just principle. What we also did with that fair and just principle is we further kind of operationalized it, passed an ordinance through our council, and it was passed unanimously, in which they say, okay, what does that fair and just principle look like, and how are we going to really make that work in a reality? So really that's the part of the work that we do around equity and social justice, which really lays out, we have a team that has representatives for all departments and agencies. We have work plans within each department and each agency. And we all, every year, say, okay, what are we going to do in terms of our policies and our decision-making, our organizational practices, and how we work with communities, both as departments and agencies and also across King County. One of the things that we're trying to address is also within ourselves and our county government is to break down the silos that we have. Next slide, please. So really, one of the posters that we have created that really show what we're trying to do in one of the images is we call those conditions, what you saw in the middle of the stream, the determinants of equity. And this is a poster that we have that talks about those. And we have defined 14 determinants of equity, which are those social, physical, economic conditions that we want everybody to have access to. And that's really what's been our focus. And it's very much embedded into everything that we do, not as a separate plan. We haven't arrived. We still have, the data is there, right? And we have those numbers, but we're trying to make sure that we're integrating this in a very systematic way in the things that we're doing. Next slide, please. So just a few examples, and we have developed also tools around each of these things, around policy and decision making. We have an equity impact review tool. Around community engagement, how we work with communities, we have a community engagement guide. We've passed some policies, for example, translation now, that when you do particular work, you have to translate at least into Spanish and then consider other languages. those kinds of things. Here's some of the things, though, that we have been, the county has done recently and how we're integrating this. Increasing more and more, we're really looking at equity in our budgets and our business plans. And how do we do this? One of the things that we have done, both on the executive side and also the council, which then looks, examines, asks questions about the budget, ask for every decision, every change that we might have in the budget, they ask, how is this going to impact low-income communities, communities of color, limited English proficient populations? What's going to be the impact? And are they going to be negatively impacted? And if they are going to be negatively impacted, then how are those negative effects going to be mitigated? What are you going to do to counteract some of those negative effects? And ideally, it's going to be a pro-equity decision, something that's going to expand opportunities, right? So we might have somebody who's saying, a department that says, we have an office and we want to move it from one location of town to another location of town. That's great, and you're going to save 5% rent on and be more efficient. That's great. But really, are our communities going to have better access to services there? Are the communities that we've been talking about, the ones that have the greatest needs, low-income communities, communities of color, and have access to this? That's some of the things that they have to answer. Some of the things that have come up from some of the recent budget decisions and have been thinking in terms of the equity focus in mind that even have affected this area include with Steve Cox Park, for example, the installation of artificial turf, also the restoration of the storefront with the sheriffs as well. Those are all things that have been done, especially with given some of the equity and social justice considerations. We've talked some, and you're aware of some of the challenges we have with transit. There's a low fare option, which is being worked on right now, which is important in terms of low-income communities, but also even in some of the plans, like for example now with our transit plan, before we had the strategic plan for transit was more based on a geographical, making sure that groups were equally served throughout the county. It's almost like spreading butter, making sure everybody kind of got an equal share. But now it's really thinking about, and it's written in within the strategic plan, to say how are the low-income communities, communities of color, going to benefit from the allocation of routes. So social equity has been added as part of the new transit plan. And other things that we're doing in terms of, for example, reforming our procurement and contract work to try to see how we can do things, especially to benefit some of the smaller businesses and contractors. So I think that's going to be it for me. Let's go to the, yeah. There's a website, kingcounty.gov/equity, if you are interested in learning more. We have an annual report and a lot of other information there about the work that we're doing.
Thank you.
Are those stats, is any of that on there? Those stats you showed us about the makeup of the population and whatnot?
Not specific to North Highland. Those aren't there. Those I picked those out just for this presentation, but I'm happy to share them. We can leave a copy of the presentation here with you.
Yes, that'd be great. Thank you. Thank you very much.
Great. So a question was posed a few minutes ago, saying, "So what are we going to do about what we see as the inequities in the community?" I mean, because King County leadership and employees don't want to have a county where it's a tale of two counties. That in one zip code, between two different zip codes, there's a 10-year differential in longevity, or there is a $100,000 difference in income, and that exists here in King County. And so our role and goal is to try to do something about that. And so one of the things that we just launched this last year to try to address some of these issues is something that's called the transformation plan. And what we are trying to do is transform how we provide services so that these inequities do not persist in our community. So I'll explain a little bit about what this transformation plan is. The first thing is, as Matthias talked about, is it needs to be community focused. And so what we are doing is looking at different areas, all the areas within our community that have a lot of the red on the maps. And what we will be doing is going into communities and inviting communities to say, we want to work with you. We're not coming to say we have all the answers about what needs to be done, but we do have a lot of resources. And so working with communities to say, what are some of the things that you believe are needed in this community to change some of these outcomes? And so if we're looking at things like unemployment rates, what are some of the things that are needed in this community for employment? What are some of the things that we can move all of these benchmarks so that the reds turn into greens in a community? And so we are partnering right now with the Seattle Foundation, who will be bringing money to this effort. And even though it's called Seattle Foundation, they provide funding all throughout King County. We're also partnering with a national foundation that's called Living Cities. And Matthias and I just spent a good portion of today with Living Cities, who is who will be most likely providing a grant to King County to work on some of these issues. The intent is when we work with the communities, we hear the range of solutions that communities are looking for. We, as the county government, need to figure out a different way of providing funding in the community. Right now, as many of you may know, funding comes out in a somewhat fragmented way. We provide funding over here for organizations that serve survivors of domestic violence, and we have affordable housing money over here, and we have money for food banks over here, and mental health over here, and substance abuse over here. You know, public health has their work over here. The goal of the transformation plan is to figure out how to integrate all of those things, so the person who needs assistance doesn't have to try to navigate a very complex system to get all of the help that they need. And so the goal is to enable people to get all of the help that they need, but only the help they need. So we wouldn't say somebody who's walking in the door for assistance gets 15 different things if you don't need 15 different things. Maybe you just need 2 things. And so figuring out a way to provide services in a different way. We don't have all the answers to how this is going to work, and the county is really looking towards a model that some of you may have heard of, which is called lean management. It's something that Toyota has used in their production, and now recently several hospitals, Swedish, Virginia Mason, have adopted this. And one of the primary tenets of that is to say, you know, for Toyota, they talk to the people who are on the line. And anyone who is on the Toyota line, whether you're installing, you know, the tires, a door, if you see something wrong, you can stop the line at any point in time. And so we need to work with the community and figure out how to do a better job of putting the resources in the community so that they're more effective. So working with the community and trying to do integrated services is one of the primary goals here. Another goal, which Matthias mentioned, is how do we start moving more towards prevention? Crisis intervention costs a lot of money, and ultimately we don't want people falling into crisis, so we need to figure out how to work better on prevention. So there are things like transportation, making sure that people can get to jobs. Some of the work that the county has recently funded within this general area are things like improving sidewalks so people can walk safely from place to place. We've been providing a fairly significant amount of money in the schools right now on prevention programs. So for students who are high risk, we've been providing gang intervention services. We've been working on employment skills for young people so that they have the opportunity to be successful in their lives. We are providing services for substance abuse prevention. And we've been doing that through NAVO's Ruth Dykeman Children's Center and directly in the schools themselves. We've been funding small business development because one of the primary things that we need to do is help people better themselves in the community. And so we have been making some fairly substantial investments in organizations like Washington Cash, other organizations that do small business loans and provide assistance to people to start their own businesses. And then general community development work as well. So we are just beginning the process of the transformation plan. We anticipate that later this spring we will be talking to communities and inviting communities to partner with us in a conversation about how we can better provide services in the community. So I know I was speaking pretty fast and trying to provide a lot of information, but maybe the best thing to do right now is to open it up to questions that you all may have.
I just, before we do that, a couple of things.
Sure.
Is, our storefront deputy, I wanted him to say a few words tonight as well with some things. But I also, I just want to show a few slides
Sure.
of the community, and it'll just take a few minutes, so then we can start open conversation. So these are, when we talk about the community,
That looks like my yard. Change that.
pictures are, this is a sidewalk, actually. And so this is a sidewalk near my house that I have to walk through, so I could, obviously can't walk on it. And it's one of the very few sidewalks in the community. Christine Waldman, who's on our council, and I one day went out there with shovels and cleaned it up, and we also did a burial of a raccoon that had laid in the street for several days. And then then this happens again, and then there's lots of trash there, and then I go back and clean it up. So this is kind of a problem in the community with things that aren't kept up. And then this is the street after I cleaned it up.
Boy, it looks Pacific Northwest Bell can go down there.
This is that property as well. This is actually owned by a nonprofit that's sitting on account, and that's that property as well. But it's just an example. This is our downtown. This building's had graffiti, and I think the graffiti's actually worse since I took the picture on it, but it's kind of been there for well over a year, as many of the buildings in the downtown area have lots of graffiti. This is a planter bed that the North Carolina Unincorporated Area Council volunteers planted on 16 and 100. And I'm showing this simply because I'm very proud of it, but also because every time I go work on it, which is a lot of work, people stop in their cars and thank me. So it's little things like this that make a difference in a community. And it really, I never am there when people don't thank me for that. That's all volunteer work on that. And there's my truck with the barrel, and that's how I watered it in the summer. I generally do 2 barrels, but this was a 1-barrel thing.
Make one with beer.
This is one of our typical streets. And I happen to walk by this every day as walking home from the bus. And it's another one of our streets.
That's not uncommon.
Yeah, no, I know, these are examples of what the community looks like. So my mailbox actually is, I have to put boots on to get my mail there. And we've tried to fix it ourselves, but it keeps getting rutted by the mail trucks. This is an alley. There's a house there, and that's the only access people have. You can't really see, but it's all completely rutted and really in terrible, terrible shape. And it's actually an alley access for a lot of homes. So they have trouble getting to their homes there. You can't really tell, but those are all big ruts in it.
And this is King County's Crescent Road, right?
Yes.
Right.
And whoops. And I think, and that's my cat Junior. He can't go outside because it's very dangerous. There's some really tough cats out there. But I just thought I'd like that. Anyway, I just wanted to put that out there, that that's kind of what we deal with in this community. And thank you. Barbara. And I just want to take a moment and let DJ say a few words before we move on. We just had a lot of things going on in the community.
I'll give an update on some of we did have a lot of newsworthy crimes over the last month, and so I'll give an update on some of those, and then I have some some good news that kind of dovetails with what you guys have been talking about to share. So we had, I think the first newsworthy event was a robbery at the corn stand. It was a robbery at gunpoint that happened close to a month ago. What didn't make the news was the very next day that guy was caught, and the gun was also recovered. That was caught thanks to Burien police, who, as a contract of the sheriff's office, so when the robbery happened up here, Burien police officers were aware of the suspect description, participated in trying to locate that suspect that night. So then the next day they ended up finding this guy and finding, matching description, and were able to kind of piece it together and make a good arrest. So we appreciated that.
Was that the one with Guardian 1?
That was, yeah, Guardian 1 was up on that one. The night that it happened, Guardian 1 came out, and we tried to find the suspect, but because of the location there, the corn stand I'm talking about is at 98th and 15th. That is about the most difficult place for a canine to track as you can get. So that was a difficult suspect to find. Fortunately, we found him within a day. We had the shooting that occurred that certainly that made the news with the homicide there at 15th and Roxbury. It was reported that the suspect in that was arrested. The King County Sheriff's Office gang unit made that arrest. The suspect, in the charging documents, mentioned that the suspect gave a confession and had a handgun in his backpack that matched the same caliber as the weapon that was used. So more to come on that. I don't think he's been charged at this point with the shooting, but he's in custody on weapons charges, and we expect more charges to come on that. The little intel that we did have on that was that that incident seemed to be related to an assault that had happened a few weeks ago in White Center that was in response to an assault that happened a few weeks before that in SeaTac. And it was all sort of teenagers and young adults that were involved in those. So fortunately, an arrest was made on that also. The major incident that we had that we have not had an arrest on yet was the sexual assault at 22nd-ish in Roxbury. I'm going to reference White Center now because they have the info posted online that we are still looking for this guy. The intel that we have on him is that he's a young black male that went by the name of Antoine. That's the name. And so we're still asking the community that if they have any info on this to let us know. There was also, the victim had a purse that looked like this, looked like a shoe, or a high-heeled shoe. It's a really distinctive purse that was taken in the assault, and so certainly if anyone has seen or has any info on that, we're still looking for all of that.
Do you know how the victim is? Is she okay?
She is okay. She's not in the hospital anymore, but it's a long recovery in a lot of ways.
Sure.
It was a bad assault. It was a real bad assault.
I told you when
You told me.
The detectives came to my door that night. I met Kelly and Amelia. They called Flip the Badges.
Yep.
And it says, King County Police, Mr. Sweeney, you ain't going to jail. I says, go away. But anyway, I told him about this guy, and I know I've seen this bird. The closest thing to him that's got that puffy jacket, I don't say that there couldn't be more than one guy like him. But he went across from my house, across the street, went down in front of the Catholic church, and then headed down. I know where those woods are.
Yeah. So if you see something or know something, please report to the sheriff's office or 911. So some of the good news that I want to mention is we are going to be kicking off the LEAD program, which stands for Law Enforcement Assisted Diversion. It was a pilot program a few years ago that Seattle and King County developed for Belltown and Skyway. And so Seattle has expanded it into Pioneer Square also. We're going to start using it here in White Center and maybe anywhere else. What this program was designed for was to take low-level drug or prostitution offenses, and instead of inputting those people that were involved in those into the criminal justice system, to divert them to counseling resources or social help. there's a lot of discretion in this program. It's the police working with the prosecutor's office, working with these social service agencies to find good candidates. The idea being that we can prevent or stem some recidivism by getting these people help that they might need. And that can range anywhere from a hot meal and a place to stay to some longer-term drug services or housing services or things like that down the road. They'd be working with case managers for some of those longer-term resources. It's a program that Seattle has really liked, that King County has liked up in Skyway. We're going to kind of restart it in Skyway because it stalled a little bit and kick it off here in White Center too. I think fits very well with some of the topics from tonight, and we hope that that we can make good use of that around here. From my perspective, I think it's a great fit for the neighborhood because I often encounter people that are involved in crime because they don't have a way to get some help that they need, and sometimes they just need to know the right resources to change the circumstances, or they need someone to help them manage some of the services that they might have access to, and that's what this program is designed to do. So there will be more on that hopefully to report. Yes?
Will you get additional manpower for that?
No, there's no additional manpower. It doesn't really take much from our perspective. It requires the police to be aware of the program and to properly identify good candidates and then get them, rather than taking them to jail, get them plugged into these services. They have the manpower that actually does the case management, that does the placement. We just have to find the right people and get them in. So I'm the manager of it on our end here in White Center. Brian Barnes is going to be the manager in Skyway. And so we'll kind of see how it goes. If it takes more work on our end than we're able to do, then we'll try to find some way to do it. I know that the sheriff and our command staff really likes this program, so we think it's going to be a good fit here.
Theoretically, that actually could make more time for you.
It could, yeah. I mean, that's the idea, right? Long term is that it's going to make a dent in crime in the neighborhood. Mm-hmm. Yeah.
When does that start?
Well, it starts whenever we can get it up and going. The program already exists. I haven't been fully trained on it yet, so that comes this month, and then it will just be a matter of identifying the right type of person or the right candidate for it. There are some people that just won't be a fit for it because these type of services wouldn't fix the problem that we're seeing. But we went through just sort of roughly estimating, went back 2 years, and we're looking at all the arrests in White Center over 2 years, and easily came up with 100 different people that we thought could be candidates for this program. So we think there's good reason to have it here. Yeah.
I see more gang signs around the neighborhood. Do you know what the status is of, for the last couple of years, it's been very quiet in this area. I just wonder if you have any information.
I don't. What you're seeing is accurate, but we don't have a good explanation for it yet. Yeah.
So was that suspect in the shooting, was he gang related then, or?
I don't know that that was part of the crime. I don't think that, I didn't get an indication that was part of it. Yeah.
How are things at Top Hat? I saw you and some other sheriff people at the convenience store.
And you didn't say hi? I was talking with someone about Top Hat the other day, and we agreed that Top Hat is a mostly quiet neighborhood except for a couple blocks. And those blocks get a lot of attention from us.
Which block?
Like the 10800 block of First Avenue Southwest is one of our favorites. And there's a couple others. So there are, I've mentioned this in this group that we've had a lot of auto theft and vehicle recoveries that are traced back to that Top Hat area. That's still continuing, but we've made a lot of arrests of people that were sort of known troublemakers. And so we think that that's going to at least disrupt the patterns that we had for a little while. We are still giving a lot of attention out there. But for the most part, except for like a few blocks, we haven't had the residential burglaries that we were having, last summer. Those have dropped down for the most of Top Hat. And it's pretty quiet, except for a couple of those areas. Yeah.
Do you have any kind of feeling for or knowledge about how the crime stats in North Highline compare to countywide? I get to ask this question a lot. So.
Yeah, I don't know. I don't want to.
Okay.
Yeah. This is the only place I work, so I know what it feels like here, but I don't know anywhere else. I'd be guessing if I started talking about it. Anything else?
Any questions?
Okay.
I want to say thank you very much.
Yes, thank you. I just want to say too, the reason I showed those photos is that, this is our reality. And, I have neighbors with young children on my street, and so that's what they see every day. And I don't think that's good for anyone. It's a feeling of this is where I live and nobody cares about me. And, I have to walk through mud, and I'm saying that, these kids, I have to ride my bike through mud and water to have fun, and there's no sidewalks, and there's few really recreational places for these kids to go. So it's not a great environment to raise kids in. I mean, it would be. It is. I feel like my community is a very good community, but I don't think it says that we care about you. When you look at pictures like that. So that's why I showed them.
Sorry.
No, go ahead.
Go ahead. So I guess, tagging on what Barbara was saying, it's like there's two communities. The development and low income, the new housing, that it's somehow cleaner. And then us in the older houses with no maintenance, no nothing.
Well, I mean, our houses are maintained.
Well, our houses are maintained, yeah. So that's its sort of division in the area. One of the words that came up when you were talking was integration. I wrote it down and then I heard you talk about it. So how are we going to integrate? We're going to move out of the handout mentality. I'm pausing questions. I'm thinking about where I live and what I see. I never go downtown White Center at all because I don't like it. I live here like blocks from it. But I don't want to see the sex shops, and I don't want to see the marijuana shops, and I don't want to see the pawn shops every other block. And how is that impacting and promoting the poverty mentality? The pawn shop. Okay, I'm going to pawn this and pawn that. So I don't have to work. I go and pawn. I steal and I pawn. That's what's happening. So it's a big change. And yeah, it's good to see all the numbers and things, but I don't know how are we going to, as people and as government and as community, how are we going to make it alive? How are we going to bring this change? It would be nice if the change were for the good and not to make it worse for everybody that lives here, and then we will flee, the good people, whatever color, I look white, I am not, I'm Hispanic, but I look white, so I feel discriminated too by the Hispanics because I'm too white. But, so it's just interesting. It's an interesting conundrum, but I feel I don't want the good people to exit this area, and I don't want crime to move in and destroy it completely. That's basically, so I hope the government, and I thank you for taking the time in the evening, away from their families to come and talk to us, just to think about these things and you have the brains, you know, and the power to make decisions and whatever, move things. Anyway, that's all.
The woman in the back has had her hand up for a while.
My name's Elizabeth Gordon, and I sit on the NHUAC Council, and I'm a small business owner in this area, and I've also done academic research on social...
You missed my gratuitous mention of Uncle Mike's at the beginning.
And I've also done academic research on public health issues and social transformation, and I just want to make a couple of comments that in my research, what leads to transformation is ongoing supportive relationships, particularly where those relationships are leading towards what you want to go towards. And that is one of the things that I see that is not happening in this area, those ongoing relationships for children and youth and even businesses. The LEAD program sounds very promising, and I know for us as a small business, we've gotten assistance in getting going and things like that. The problem is that we're in an area where there's 2-hour parking that isn't enforced, and led to that federal sting because the people who were parking were they had their mobile offices where illegal activities were going on. And that sting cleared out a lot of stuff, which was great, but now there are other different problems because, you know, we have the marijuana place and the ventilation system doesn't work, and we're a family restaurant, and, you know, there's no parking for people, and there's graffiti everywhere, and so, and there's also a problem with public inebriation. And all of these things are issues in this area because the policies and regulations in this area differ from those in Burien in Seattle that can help affect that kind of a change. But as far as relationships, I also sit on the Coalition for Drug-Free Youth, which is a preventive thing, and it's in the local schools and things. Well, one of the things that leads to substance abuse is when kids have too much time in their hand, there isn't structure, you've got 2 working parents, so on and so forth. But one of the other things is that at the local high school campus, the way that it's set up is kind of fragmented, but there is no PTA. There's no organization that connects with the community that helps teach parents and teachers and students to work together for the common good, to learn those organizational skills. The schools that have them, they are sending their children from the elementary school to private schools. So those parents and those children are not feeding into the North Highline middle schools and high schools. And so those relationships that could help prosper this area are not feeding in. And then you have also those studies, I'm sorry it's so long-winded for everybody, but you also have those studies that show that in order to grow a community, you have to have social economic integration as well as racial integration and everything like that. And that's not happening in this area because, in part, housing development and the poverty is concentrating. You might be getting some social racial integration going on, but again, if the parts of the community that have more of those skills that lead to upward mobility are not engaging and interacting with the kids, the parents, the teachers in the local schools and in the community, you're not going to have that exchange that helps everybody grow forward. And so I would hope that all of you and your policies and philosophies are also integrated into the regulations and policies and priorities for enforcement and what's happening more locally. And I don't know if anybody wants to comment on that, but I'd appreciate it.
Thank you.
Thank you.
Yes, and we're trying, but as I said at the beginning, do we have all the solutions and are we done? Far from it, far from it. I'm really proud of King County for stepping up and making fair and just one of the principles in our strategic plan and taking on the Equity and Social Justice Initiative. And we have a lot of work to do, from physical activity to sidewalks in the streets Barbara has shown us, to make streets walkable, to assist you with graffiti removal, something that frankly NHUAC does quite well in the community, and I commend NHUAC for taking that work on. And one of the questions Barbara asked us to be ready to address is, are we working with other governments? And how are we making sure that school districts in the state and the federal government are also engaged in this social equity work? And at this point, we're just learning the work and implementing the work in our own jurisdiction. And when we have the opportunity, we're certainly raising it with other jurisdictions, the school districts, for instance, because much of what you talked about were relationships that would be supported through schools. But we're not in a position to tell somebody else how to do it yet until we're doing it with some effectiveness ourselves. One thing we have done, and the council took action, is regarding marijuana dispensaries. And we have imposed a moratorium on any new medical marijuana dispensaries in unincorporated King County. And so that there should not be new ones opening. And if you see a new one opening, report them, let us know. And in fact, I know that one started to open and they were contacted and informed that the moratorium was in place. They apologized, they weren't aware that that was the case, and they closed up. So there's a couple items.
One thing that also, I mean, this is around getting the idea and going to both questions. I mean, we've been starting to have this dialogue here regionally now around equity, and that some folks have a lot of resources and others don't. It's really around getting everybody to have a common understanding of some of the maps that we've been talking about and how we create a shared vision. So even this is some of the conversation that we had earlier today too, with funders and philanthropy and others, and saying, okay, how can we make sure that everybody sees this as a common problem where we need to, even areas where they have a lot of resources, we need to be able to prioritize areas like North Highline. With, you know, in particular with the schools, we recently, we finished a big grant that was a King County grant that worked a lot with the schools, and we were actually able to show some difference. It was called Communities Bringing Prevention to Work. And I don't know if folks saw the news, but we were able to decrease obesity among children by about, I think it was about 19% or 17% in the areas that we had chosen, which were the school districts with the lowest outcomes, and that included the Highline School District. And we worked with the local school district around physical activity policies, nutrition, making sure it was farm-to-table programs, making sure that the foods that were being provided to the kids were not only you know, healthier in terms of the ingredients, but also something that they enjoyed eating. And we were able to see that where we had an intervention, or where we worked, which was South Seattle and South King County, including this area, we were able to decrease childhood obesity. In the other areas that didn't have these programs, the childhood obesity rates haven't changed. So these are some of the things, and it's that emphasis of saying we need to really focus on areas like Highline and North Highline, where we have some of these greatest needs, and work really comprehensively. And we worked also, there was, we didn't solve every problem, but there's also the safe routes to schools too, working with the school districts and making sure elementary schools have, and the kids have, you know, ways to walk and bike to school as well. So I'm trying to make some of those steps, and sometimes it's not about necessarily creating, you know, we might not have the resources to create new sidewalks everywhere, but if we can create some, you know, encourage some of the, you know, community cohesion, and you can have some, instead of, you know, walking school buses, for example, which we started doing in King County, that's a way that folks can actually, you know, walk, you know, together and be visible and protect each other, you know, as a group, so they can get to school, and it's much more healthy.
I was going to say that you mentioned several reasons why we're trying to do business in a different way. One is that the community really needs to own and engage in whatever the strategy is, because government is never going to change everything. And so the reason we need to work with community is to say, what are the strategies that this community needs, and does everybody have buy-in to particular strategies in order to change the outcomes? And we've seen there can be a lot of success in going in that direction. The other thing that your comments made me think of is really the need for integration of services too. An example coming from Tacoma actually, where there was a school in the Hilltop area in Tacoma where they had 100% turnover of the students every year, and there was no PTA or anything. It turned out the real issue was housing instability. The families were, they would become homeless, so they had to move in with relatives and things like that. It was a high poverty area, similar to some of the areas around here. By increasing housing stability, they have now stabilized the school. There's now a very active parent-teacher association in that school. And I just use that as an example to say the turnover in the school was really housing stability, and that's why we need to look at all of these problems as being interrelated and create solutions where people get all of the different services that they need, and we see everything holistically. Barbara?
Please.
Okay.
You called to mind something that I feel very strongly about. There is a concentration of poverty in this neighborhood, and King County has been behind a lot of it and supportive of it. We need economic integration, not segregation. So I would say that you have to go further up the stream to look at the policy, housing policy, and I would like to know how we go about getting all over King County an inclusionary housing policy so that poor people can live everywhere, because there have been plenty of studies that show that kids do better when they come from predominantly middle income versus low income neighborhoods. That's really what we need, I think. What would we do?
Part of it is providing economic opportunity for people. In terms of, in terms of why there's a concentration of poverty here, part of it is there is housing that is actually market rate housing that is affordable to folks here. I looked at the statistics for what King County Department of Community and Human Services has funded in terms of affordable housing in this area, and only 3% of all the affordable housing that we funded throughout the county is in this area. So it's not an issue that the funding has brought people in. It's market conditions that people have moved south. Poverty has moved south over the last decade, and it's continuing to move in this direction. What we need to do is facilitate economic opportunity for the people who are here so that they have access to capital. I mean, some people are unbanked, they don't have access to capital. For some people, they don't have education, which is holding them back. And for some of those people, the solution may not be that we have to say, you're 30 years old right now, we want you to go back to school, but it may be an access to capital issue where we say, okay, you're a great cook, so maybe we can work with you in a loan program and you can get a food truck. Many of us come from immigrant communities where our grandparents' parents didn't come here with a lot of education, but the communities were able to put things together, and the next generation was able to achieve a lot more. And so we need to make sure that those opportunities that previous waves of immigrant groups have had are available to people who are in the community now as well.
So, do you have any idea why poverty is moving south? I mean,
The
you say
housing's
poverty
cheaper
is
here.
moving south.
The
Don't you
housing
think
stock
that's
is
part
cheaper.
of
It's
it's like a cycle
That's not.
where, there's a high density of public housing here, which when you put a high density of public housing in an already low-income community, it doesn't increase the housing, the values of anyone's home. If you
Actually,
put in
some of the studies might really be surprising to you. There's a study out of New York University, out of the Furman Center of New York University. And actually what they found was, and it was specifically something called tax credit housing, that when low-income housing was built within communities, it actually raised property values. And the reason for that is because the housing stock was new. We just had a comment earlier saying the Tale of Two Cities right now looks like, in a way, everything that's at Greenbridge is nice, the sidewalks are nice and new there, and so it's, when you have new development that looks good, that's high quality, it actually raises property values all over. A lot of times, many of the issues come from absentee landlords, people not making investments in their property, and that's what drives property values down.
Lord Harrell will disagree with you.
Yeah, I do too.
Yeah.
This gentleman's had a hand
Go
up a
along
lot.
with her and her. I've lived in this area for 34 years. Before that, I lived in Rainier Beach, just down the hill, for 20 years. And in the 34 years I've lived in the White Center Highline area, I have seen it deteriorate. The businesses are deteriorating. Family businesses are leaving. The businesses that are here are the type of businesses that the people that are poor don't facilitate, like hardware repair and everything else. You have the same problem in Skyway. I used to drive from Rainier Beach to Renton and work in the kite factory over there. And I went right through Skyway, and all of the stores that used to be there, family-oriented businesses, are now gone. Anything except the bowling alley that's there is something that the poor people don't use. So the housing authority needs to share the wealth. They're killing these communities, and they're not aware of it. We're trying to make them aware of it, but they don't listen. They find a square block that there's nothing on, they want to build on it, no matter where it's at. And it happens to be in our area. You need them to think a little bit before they do that. So please, get them to think a little bit.
I mean, the housing values have dropped everywhere, but our community has had a very, very significant, greater drop than the surrounding areas. And then you have the issue of why do we have in our downtown area 8 marijuana markets, dispensaries, in a low-income community with very high-risk youth. And this is what happens when you have a community of poverty.
Just gonna, a hand was up in the back.
So you had mentioned that there was only 3% of housing in our area was maybe public housing. One of the problems has been in this community for a long time that government agencies have paired with nonprofits to also build low-income housing or subsidize low-income housing or build the low-income housing. And they like to do it in areas where it won't cause a big stir. And so typically they choose neighborhoods where the citizens maybe don't have a voice or can't oppose it. People in Magnolia are not going to be very friendly to a big nonprofit housing development that's going to serve low-income people and move a whole bunch more people into the neighborhood that weren't there before, that were maybe spread throughout the city or the county. And then they're going to bring them there, concentrate them, or get people off the streets and put them here. And so for maybe 20 years, project after project after project continues to happen in our area. And so even though a very low percentage of maybe the construction was public housing, a huge amount of people in our area actually receive housing assistance. So when there is a neighborhood like this, and that is not thought of all the different pieces that fit into that low-income housing puzzle, and these projects continue to go on and on, it makes it so the entire area has no tax base. And it also makes it so most of the residents in the area don't have money to go to stores and spend. They can't go support the restaurants, they can't support the ice cream shop, they can't take their kids, and to do activities in their area. And so there's no basis for businesses to open. I'm a small business owner, and I was recently looking for office space, and I considered White Center because I live in this area and I would love to support it, but there not only is a shortage of office space that it would be professional enough to be presented, but there's also a lot of problems in our community because we have less access to transit. So I knew employees who rely on public transportation would have a very difficult time getting here. And that's just one of the issues, So I think it's really important to remember that there's a lot more things going on in our community. And at face value, it may appear that, there's very low percentages of these things going on. But really, it's so integrated in our community that it's caused a systemic problem that needs to be undone rather than kind of added onto. For Seattle specifically is considering bringing us on board, bringing us into Seattle. And part of their plan for our area would be to make it more dense. And when you're doing that with a very low-income neighborhood already, a lot of that density will probably be more low-income people coming in, and that's not good for our area. We need to raise this area up to the middle class, provide opportunity from within our community for employment in our community, and stop just being a dumping ground for all of the other neighborhoods who would rather have that open around.
Rachel, what did you
Thank you. People have spoken so very well to the problem of density, supported density that does not help support everybody. And I think that's one thing. But one thing when Elizabeth talked about no PTA at the Evergreen High School, or the article that was in the paper the other day about the Bezos coming out here with a program to help make the brain power in babies better or something like that. Not only is this area a dumping ground for poverty, but there's the money to be made from nonprofits that come out and seem to think they know what would be good for the community, dump it, put it down, make it work for a while, and then where does it go? It doesn't come from within the community. I mean, it's great to have programs for parents, there's no doubt about that, but how are those decisions in using nonprofits? Who gets to make those decisions? Who got to make that decision to bring that kind of outside force into a community? Does anybody know? I mean, I don't know. I'm talking about what we can talk about. The Gates Foundation, they did a wonderful thing. They made a big, facility for early childhood. That's great. But how about all the other kinds of nonprofits that operate in the community, who make decisions for the community that the community doesn't get to have much to say about?
Well, Rachel, the nonprofits make the decisions about how they're going to operate, what services they're going to provide, and the Taft Academy is in the park now and working with kids in the neighborhood, and the Bezos are exploring opportunities, and Gates has been here. In many cases, they partner with, for instance, the school district or other local governments or existing providers, and in some cases are coming in, starting their own programs here. But nobody's forcing the community to participate with it. They're coming in with ideas, offering them, and trying to reach out and enhance the community. So,
if the community can be part of the whole process, that's great. I mean, I don't know that. I mean, I'm far away enough from the schools, but I have heard many parents who did not like the idea of the 3 campuses over in Evergreen. It took away the school spirit. They couldn't even get money for their booster program for uniforms for the kids. A school is the heart of a community, and dividing it up, I don't know how that got done, but anyway, there are even injustices there in the way in which kids are put into classes. Yes.
Ms. Quinn, I want to address one thing with you. You said to bring the community together. I hope you understand this is a very fractured community. There's some politics involved with that. I'm not talking about that. I'm talking about it's a very diverse ethnic group, area, a lot of different populations that tend not to interact with each other. And when the county comes at them, they say, they're not interested. I mean, they just don't get involved. And so there's very few people in this community. It's a great community, but I don't get that. And I've been pushing this for years, and I know a lot of people have, how to get this integration, into focus. The other thing is I was attending something recently and found there are 103 different languages spoken in the, Highline School District. That amazed me. I thought it was 50 instead of 103, but I got corrected. One of the things, there are 11 marijuana shops between First Avenue and 35th Street, with 8 of them being concentrated in downtown White Center area within 4 blocks of downtown. I don't think that's very good for the community. And it's not being addressed at state level. So far, the county hasn't addressed it except to stop further ones. But the ones that are here now can stay forever, as far as I know. I work at a retail establishment several blocks from downtown White Center. And I constantly talk with people about, oh, where do you live? This is part of my personality. And I said, oh, have you tried so-and-so in downtown White Center? Oh, we never go down there. We're afraid to go down there. And I a lot of people, I'm not talking about a few, I'm talking about a lot. I got a call the other day where I work, and the person wanted to know where our store was in North Seattle. In West Seattle. I said, we don't have one there. And she said, well, can you give me the address for the Woodinville store? Well, I said, we're right down here in White Center. We're not very far from you. That showed me right away, that person was afraid to come to White Center. They were willing to drive all the way out to Woodinville to find the item they needed. And that's the perception. I'm sorry, that's the perception. That's why I was asking BJ about crime stats. The ones I've seen over the years, we're seeing to be kind of in the middle. But that's not the perception people have. They think if you walk downtown White Center, you're going to get shot in the street. And that's the first thing when I went to work a number of years ago, and I told people where I lived. First, I didn't even tell them. First year, I didn't want to tell them. Then I thought, oh, okay, I'm just going to tell them. They said, oh, you live down there? Are you safe? Are you afraid to walk the streets? Well, I'm not going to go out at 1 o'clock in the morning and walk in the streets, but generally I feel safe.
Don't go to Beltline at time either.
Anyway, some background.
Well, we don't have a local governor. The North Carolina Unincorporated Area Council, King County made a decision several years ago to cut the ties in a sense. We operate with no funding, and we're a group of community volunteers, and everyone on the council, we have a few people here, our council members. We volunteer a lot of our time to this community. And, as volunteers, well, it's difficult. And we bring things like that, we brought you out to this community because we feel these are important issues. With volunteers, there is a level of burnout that goes along with that as well. But it's difficult here. It's difficult. And many of us here are very dedicated to this community. We want to see this community do well. I've lived here 10 years. I moved here from out of state. And in that 10 years, I haven't really seen a whole lot of improvement here. We went through, Joe knows about Club E. We went through years of problems with this club, and then we had the big bust with, I don't know if the guns and the drug bust that went on that had been going on for a long time. It's just, and now we have all the marijuana shops. We have some good marijuana, some good folks running some of the shops, I'm not saying, but we have some bad ones too. But why does the community, what I was told by some people is, what do you expect, Bakery Nouveau to come here? So you're going to get marijuana dispensaries. So that's what happens when you create a community of poverty.